Wendell,
Yes, Chairwoman.
I don't believe we have a quorum.
We don't have a quorum just yet. We're
Okay.
still waiting for one member.
Yes,
We're at 4:58 right now, so we got a couple minutes.
2 minutes, right? Okay, I was just verifying we were on the same page.
Yep, correct.
Thank you.
Chairwoman Walsh, the time is now 5 o'clock. You do have a quorum, so you may begin when you're ready.
Okay, I'm ready.
You may begin.
Good afternoon, everyone. My name is Loretta Walsh. I'm the chair of the Wilmington City Council Public Safety Committee. This is an official meeting of such committee. Before we get started on what we're discussing this evening, I would like to take a roll call, please. So myself is here.
I'm present, Xanthia.
Councilmember Oliver,
Thank you.
Councilmember Gray,
Present.
Councilmember Johnson is excused, Councilmember Spadola is excused, Councilmember Mills is excused, Council President Congo,
Here.
Councilmember Walsh.
yes.
I'm here intermittently as I can.
Okay, thank you, Councilmember Spadola. All right, we have a very short meeting this afternoon. We have one resolution and a presentation by our fire chief. We'll get right to the resolution. Who do we have here from the police department?
Inspector Cecilia Ash.
I'm sorry, we can't hear you. I can't hear you anyway.
Inspector Cecilia Ash.
Okay, thank you, Inspector Ash. This is a resolution approving the police department's grant application to the State of Delaware Special Law Enforcement Assistance Fund to upgrade and replace existing equipment. Inspector Ash, the floor is yours.
Thank you, Madam Chair. Good evening, everyone. Inspector Cecilia Ash here for the presentation of this. This is a grant that is offered by the State of Delaware Special Law Enforcement Assistance Fund, also known as SLEAF. Like other Delaware law enforcement agencies, we've been invited to apply for these funds, which assist in replacing and upgrading police department equipment. This is a equipment grant only. What we are requesting is and applied for $65,000 in funding to support 2 purchases of equipment. The first being 3 ballistic blanket protective systems at the cost of $30,000. These are blanket-like equipment that can be used to prevent or withstand gunfire. The second item is 2 robotic devices at the cost of $35,000. These are to replace 2 robots that we currently have that are no longer effective. And this is used by the critical management tactical team to establish communications during various events. And there are no required matching funds from the city. This is free money. That's all I have, Madam Chair.
Tell me exactly what a ballistic blanket protective system is, please.
Yeah, it basically, Madam Chair, it's very much like a blanket. It can be used to resist gunfire. If you had to evacuate victims out of something, you would use the ballistic blanket as a protective device to get citizens out of harm's way.
And how many do we currently have?
None.
Oh, none at all?
That's correct.
Well, that's not really what this says, I don't believe. It says to replace existing equipment purchased in 2005.
Yeah, I'm sorry. That's correct. I misread that. Thank you, Madam Chair, for correcting me on that. Yes, it would be replacing the existing equipment purchased in 2005. That's correct.
And do you have any idea how many we currently do have that were, I see we're getting 3 of them, but do you have any idea how many we're replacing?
I believe we're replacing 3.
Okay.
1 for 1.
And what do you do with this outdated equipment once we get rid of it?
With that, I don't know how useful it would be for anything. I think, it's not as if we could donate it to another department or a smaller agency because it's just a liability. So some of these, may be destroyed because they're coming up on their expirations.
I guess that was my part of my question. If they're destroyed, is there some place that outdated police equipment gets sent to where they all get destroyed?
No, in this particular situation, it would be what we would call like a burn, where we're getting rid of equipment. We just, burn it down. We have a company that does that.
Okay, thank you.
Yes, ma'am.
And what about the second one?
The
What do
second-
these devices do? Do they like crawl into a room as you're negotiating with somebody?
Yeah, so it
Or
gives
are
us,
they little robotic?
yep, it gives us the ability to establish communications during barricaded subjects or hostage situations, basically where we would use the robots to deliver communication devices during any of those type of critical incidents.
Okay, thank you, Inspector.
Yes, ma'am.
Council members, starting with committee members first. Does anyone have any questions?
Yes, Chair Walsh,
Councilmember Oliver?
thank you. Madam Chair, I was going to ask, what do they do with the equipment? So she just said I'm sorry, what did, to Ash say? I'm sorry. Did she say they just throw it away?
Basically,
Okay,
yeah.
We do it, Councilwoman Oliver, we do what we would call a controlled burn, and the equipment is dissolved that way.
thank you, Inspector. I'm sorry. I heard some of it, but I have faded out. Thank you.
Yes, ma'am.
Okay.
Any other council members have any questions, including those who are not on the committee?
I have my hand up.
I'm sorry. Thank you, Councilmember Gray.
What are the robots used for specifically?
The
And-
robots-
Go ahead.
The robots are specifically used to deliver communications during any type of barricade situation or a hostage situation. It helps us to establish communications with those that are inside a building or, any other type of facility to help establish communications on high-risk operations.
Thank you. Do you have a picture of what they look like? I mean, is
I
that-
don't have one on me, but I can, see if we can forward that over to you via email to the council and to the
Okay.
Public Safety Committee.
Thank you.
Yes, ma'am.
Anyone else with any questions? Any members of the public who would like to ask something? Seeing none, we'll move on to the second agenda item today. Thank you, Inspector Ash. I appreciate your attendance. For those who might not know, the chief had an engagement that could not be canceled today. So we got to see the second in charge. So thank you for taking the time to come and address us.
Thank you, ma'am. And thank you, council.
Okay, our second agenda item is being presented by Fire Chief John Looney to discuss policies and procedures related to overdose calls and fire academy completion rates. Chief Looney?
Madam Chairwoman, thank you and good evening. Good evening to all city council members present. The Wilmington Fire Department, as it relates to overdoses, Wilmington Fire Department began carrying naloxone, also known as Narcan, in 2018, July of 2018. This was an initiative implemented under the leadership of Fire Chief Michael Donahue. After a signing of a Senate bill by Governor Carney, it was allowing all public safety personnel to administer Narcan. Right now, all our frontline fire apparatus and administrative vehicles carry the Narcan, and all of our WFD personnel have been trained to administer Narcan on the street. WFD, we do have an SOP for this Narcan program. It was established for the administration, maintenance, and deployment regarding Narcan. We have a partnership with St. Francis Hospital from the onset with providing Narcan to the department. We work side by side with St. Francis EMS and Newcastle County paramedics as it relates to overdoses. I mean, our personnel, we're about 95% of our department is certified as nationally registered emergency medical technicians. They receive this training. Each member receives this training when they're in rookie school. It's approximately 6 weeks in length. We go on a various amounts of medical responses, along with St. Francis and Newcastle County paramedics. I'm not sure how much, what else you would like to, capture when it comes to policies and procedures, as in overdoses. I mean, overdoses come in, many forms, not just, the opiates.
Chief, you're not the first line call for an overdose. If one calls 911, the fire department is not the first responder, is that correct?
Actually, ma'am, yes. When the call goes through the 911 center, the Newcastle County Emergency Communication Centers, their trained dispatchers have a system that they have out there. It's the emergency medical dispatch system. They ask the caller numerous questions, and from that, they're able to, gather the information and make the call, code the call, and then dispatch the appropriate units. We do respond on these overdoses, but we're right alongside St. Francis EMS and the medics. But yes, to answer your question, we do respond on these.
but they're the ones who give the shot to whomever they've been called to help. Is that correct?
Yes, that's correct. But there are times where WFD personnel arrive before the Newcastle County paramedics and the St. Francis EMS. So we're able to administer that Narcan, and it's not injected. It's inhaled. It's in a liquid form that we have certain procedures. We've been trained by our training division and following all the protocols from the Delaware Emergency Medical Services Department.
Can you tell me, when you're trained on this, what is the optimum time that the medical personnel state one should be given this drug?
Well, we since we're trained as nationally registered EMTs, what we'll do when we first get on scene, say we're there first, we're going to do a patient assessment. We're going to perform a patient assessment. We're going to determine that the patient is unresponsive, their absence of breathing and or pulseless, and it's a potential overdose state. We try to gather that information by bystanders and any indications of it's a drug overdose in the surrounding area. But once we get on there, I mean, we're normally there very quickly, and we follow our protocol for the administration of it. We give up to 2 milligrams of Narcan.
Can you tell me how long the drug is good for? And by that, I don't mean the drug that's put in the patient's body, but the drug that is given to all those personnel to hand out to people.
We like I said, we have a partnership with St. Francis EMS, and actually, we just all our expired Narcans, approximately a year. We just changed everything out, and we have a whole new stock of Narcan that we received from St. Francis Hospital. It's on all of our admin vehicles and all of our frontline apparatus to it, which includes our engines and ladder trucks.
And could you tell me, Chief, do you keep any type of record on whether there has been an uptick on the amount of people that we're helping?
No, ma'am, we don't capture that data. Actually, with some of these runs, you may be, dispatched for, a subject fall, and then you find out, you get there with all the other agencies, and it turns out that it was an overdose, but as it was called in as a fall. So it's kind of tough to differentiate or we would have to get into every run, and, we don't do that presently. We don't capture that data.
Do you have a check sheet that the supervisor of that run has to fill out?
Yes, we have a state form. We have a reporting system, but we do have to fill out a state form and send it down to the State Office of Emergency Medical Services.
Okay. And do you
When we
think that,
administer it, St. Francis Hospital and the Newcastle County paramedics, they would have to follow the same direction also.
sure. And just on a personal observation, do you think there has been a bit of an uptick on this?
I think we've stayed pretty steady over the last couple of years. Obviously, statewide, obviously it's an issue, serious issue at hand. But I think we've stayed steady. I wouldn't say I've seen an uptick.
Okay, thank you, Chief. Council members, does anyone have any questions? Council, committee staff, or committee members?
Okay,
Yes,
my hand's up, Councilwoman Gray.
I'm sorry.
Oh, that's okay. Fire Chief, I was going to ask about stats.
Councilmember Gray,
You already said. Can't you hear me? I was going to ask about stats, but you already said that you don't keep statistics. But isn't Narcan only for narcotics? What do you do when you come across methamphetamines or any of the other drugs out
Well,
there?
the Narcan, it's an opioid anti-agonist type drug. It's used to counter the effects of opiate overdoses. If it's not an opiate, that's where the Newcastle County paramedics, they will do, they have protocol that they follow and how they render that care to that patient, and they have medications that they would be using at that time.
Thank you. Who makes the distinction of the type of overdose?
Well, as I said it earlier, we do a patient assessment. Somebody that's unresponsive or comes in as an overdose, it could very easily, once we get there and we do our patient assessment, we could find out that he or she is a diabetic and they're having a diabetic emergency. So it's all through our patient assessment skills that we're trained to perform.
Okay, thank you.
You're welcome, ma'am.
Councilmember Oliver?
Now, I was just going to ask about the Narcans. How many have they been distributing when they go out? Because I know I've been working with the Lieutenant Governor with giving out the Narcans, and I just wonder how's that process coming along?
We don't give Narcan out, ma'am. To the community, is that what you're implying?
Okay, you'll just use them when it's necessary.
Yes.
Okay, I'm sorry, misunderstood.
Yeah,
Okay, no problem. Well, that's
no, it's
still good.
just-
I mean, that's
Yeah, we just
they need all the
stock
help
on
they
our
can
units.
get out there.
No, we don't do that, ma'am.
Okay, thank you. I'm sorry.
Councilmember Harley, is your hand up?
Yes, I would like to be acknowledged as well.
Thank you.
Thank you, Madam Chair. Chief Looney, I guess I'm just trying to confirm as it relates to the statistics, and I'll tell you why. As we know that we do have some issues all around the city, but specifically as it relates to the east side, there have been a number of cases around overdoses, narcotic overdoses, and the administering of the Narcan. So my question is that, one, they started a recovery group over there that they're going to be meeting every week. I went to the meeting on last week, and one of the questions that came to me, because they're trying to address the addictions and trying to work within their community to come up with a solution. They wanted to know, could I find the statistics of overdoses from narcotics on the east side between, let's say, Walnut and Church and 7th and 10th? Is there any way I could get the data? And the reason why I'm asking for it is because they asked me for it.
Right.
And I believe they just want to try to address the situation in terms of trying to get information out and have something to measure.
As I indicated earlier, it would be difficult to try to capture this data because, obviously it's the data is not going to be broken down into like geographical areas. It would be very difficult to do. I mean, that's something I can look into and I can respond back to you. But at this present time, we're unable to, provide that information just because it's not being captured as you're asking in our fire reporting system. So it would be difficult.
Madam Chair, quick follow-up.
Yes, Councilmember Harley.
Yes, so Chief, I understand that, but I think Madam Chair had asked about a report that you submit, and I would think that you would put, right. I know you don't think about it from the perspective of if it's in that report, then maybe it could be captured. Like if you write a report and it says 4th Street or whatever, the 800 block, I'm sure that kind of reporting is captured. I'm not thinking of the specific address, but the 800 block of Pine, we had a incident, or the 600 block of Lombard. I was thinking along those lines. And I can reach out to you offline and whatever I can do to work with whomever I need to work with. I'm willing to do that. So thank you, Chief.
No, thank you. I'll be looking forward to that.
Okay, thank you. Thank you, Madam Chair. That's all I have.
You're welcome. Councilmember Fields and Councilmember Darby should be recognized. Councilmember Darby, I believe you have a question.
No, not tonight. I just wanted to be recognized.
Okay, thank you. Councilmember Fields, did you have a question? Okay, anyone else on council who has any questions? Seeing none, is there anyone here from the public who has a question? For everyone, this is your time to ask the questions, because the meeting will be adjourned in several minutes if you have any. Okay, one last thing, Chief, before you go.
Yes, ma'am.
With some of the statistics that Councilmember Harley was just talking with you about,
Yes, ma'am.
could they possibly be gathered by the Newcastle County Department or the State of Delaware Department? So
Yes,
if we made an inquiry to them, they might have that information.
Yes, I'll reach out to our contacts tomorrow at the Newcastle County Emergency Communication Center and along with the Delaware Department of Emergency Medical Services to see if they can get us on the right track, maybe capturing that
Okay.
information.
Thank you, Chief. I appreciate it.
Thank you, ma'am.
Seeing no other business before this committee, may I have a motion to adjourn?
So moved.
Is there a second?
Second.
Thank you, everyone, for attending this afternoon.
Thank you,
Meeting
everybody.
is
Have a good
adjourned.
night.
Thank you.
Thank you. Thank you, staff.